They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HSHS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.
Hi, and thank you so much for joining us today for this episode of Being Well. I'm your host, Keanne Armstrong, and today we're going to be talking about recovery and the community getting involved with that. And joining me today is Jenna Hays. Jenna, thank you so much for joining us.
Thank you for having me.
So we're going to be talking about recovery, people getting involved in the community. So why don't you introduce yourself for us and tell us how you're affiliated with this?
Sure. Thank you for having me here. I'm grateful to be here. My name is Jenna Hays, and I am the Recovery Outreach Coordinator for Central East Alcoholism and Drug Council, better known as Seed Council in our area, or the Our House, where we treat substance use disorder. Seed Council holds the contract for the Ross grant, which I'm responsible for. So they're the lead agency attached to it. So I'm I'm a Seed Council employee, but I'm also a state employee and really passionate about working in the outreach community area.
Okay, you mentioned something called ROSC grant. Now, it's R-O-S-C, am I correct?
Correct. R-O-S-C, as in cat. I always have to put that little C on the end. People are very, it's a foreign term around here, and that's exciting for me. Actually, I like to get people new and involved in things that can be really successful, but it stands for Recovery-Oriented Systems of Care. And the goal behind the ROSC is, how can we be supportive of people who are in recovery in their families, and how can we support them in their journey of recovery from start to for the rest of their lives, and not just in a rehabilitation facility or a short stint away from drugs or alcohol, but also how can we support the children of drug and alcohol addicted parents. So the goal is, to treat the community and to get people involved in order to support people and get them to treatment or keep them sober.
Okay. Why don't we lay the foundation about explaining exactly what recovery is? How do you describe that to people so we can understand exactly what we're talking about?
Sure. So recovery, when I say recovery in this segment, I'm talking about recovery as in abstinence or staying away from substance use or alcohol, anything that someone has abused in the past that has caused them to have an addiction to alcohol and or drugs. That can be street drugs or prescription drugs such as Xanax or other opioids like prescription pain medicine. And recovery, what recovery looks like is someone living a clean, that means off of drugs and alcohol, healthy, sober life, and really blossoming into their life. Not just staying sober, but actually getting plugged back into the community, living a fulfilling life and not having that stigma attached to them. I tell people who aren't familiar with recovery or people in recovery, we want this alcoholic or addict who's gotten sober and changed their life to really feel like they're a part of the community and not apart from the community. And if we can start to include them in our community and not have them labeled as the them, then it improves their life, but it also will clearly, because it's prevalent in our area, it will start to improve our entire community.
Yeah, absolutely. Now, drug and alcohol addiction is a disease. Am I correct by saying that?
Yep, it is a disease. It's recognized by the American Medical Association now. It can be, disability can be claimed from it. It's a brain disorder. Studies have been done back to 1932 by doctors, and any doctor that you talk to today will clearly 100% say alcoholism and addiction is a disease. It affects the brain. People who have drug or alcohol addiction the receptors in their brain act differently when the substance is put into their body. And people often think, well, don't they have a choice to just stop? And at some point, yes, they do. But once that they've sort of crossed that threshold, there's really no coming back until they want to stop. And then that's where there usually needs to be some sort of intervention, either a positive connection with someone in recovery, a treatment facility, sometimes a church. But then we want to really grab a hold of them once they decide they want to stop and really hold their hand and just show them that the community supports that decision and wants to help them continue.
Absolutely. And I think it's very important to explain that during this segment, is that it is a disease, and once there is education involved, not only for the people going through it, but their family, their friends, their coworkers, and the community as a whole, then we can all understand how we all work together on this. And I think that that's exactly what you're doing out in the community.
Yeah, exactly. Often we want to make sure that we're supporting the person who's either in addiction and recovery, but also their family and their loved ones. You would not believe going out into the community and getting people to, sit on these councils in these counties, the shame and the stigma that family members felt just because their son was addicted to prescription pain medicine, or their daughter was using methamphetamine, and they felt like it was a direct reflection of them when it's not. And we want families to know that there's services and support for them out there too, and we want to band together and really, really support those people too, because they're carrying the weight of a lot of things they really shouldn't have to carry.
Exactly.
And it can be really sad. So it's important for us to get out into the community, and we are the first agency south of I-80 to get this grant, so it's super exciting because we're rural. I don't know if they thought, since we're rural area, that we couldn't quite, get this together. Because up in Chicago, you have a very small geographic area and it's condensed population. So for us to get that same population, our grant had to cover Coles, Cumberland, Douglas, and Shelby. We had 4 counties to start with, and Effingham County, somehow, I think their drug court heard that we had this grant and actually came to me and called me and asked if I would, go to the state and actually ask if they could be added to our grant, and they were successfully added. So we have to have a very large geographic region in order to have the same amount of resources as a small area and, say, a big city would. But there's been lots and lots of studies done in other states and in bigger cities that show when these ROSCs are formed, you might not see direct success 2 or 3 months down the road, but you give it like a year, 3 and 5 years down the road, and that population starts to be included into the community, and that community starts to improve. The unemployment rates go up, or the unemployment rates go down, the undereducation rates go down, and the poverty rates go down. Because right now we're high in all those areas in East Central Illinois, and the goal is help that target population and you help your community.
Absolutely. It's important because we all want to see our communities thrive, and we want to see that the people in our communities are, giving back and are a part of the community. So when we're talking about this and you're talking about substance abuse and alcohol abuse, you hear the term opioids a lot. Now, does that only refer to heroin? And I want to explain this for our viewers out there. And is methamphetamine separate from that? Is it included in that? Are they street drugs? Are they prescription drugs? Explain that a little bit, and then we'll go into how people are involved in all this program.
Sure. So in East Central Illinois, pretty much across the board, adolescent, adult, alcohol is still the #1 misuse substance. So sometimes we hear about the opioid addiction, but we forget about alcohol. So it's still the #1. Then you have your street drugs, they call them. That's your cocaine, your methamphetamines. Those are all stimulants. Those are separate from the opioids. And then you have prescription drugs. Oh, and then you have your hallucinogens like your LSD and that kind of stuff. And then you have opioids. And opioids, we're hearing a lot about opioids right now in the news. And it's because opioid people are dying so much. And that's because they're dying of heroin overdoses. Because heroin has been being laced with other drugs that are tranquilizers and fentanyl, which is a very strong opioid. And it's killing people instantly. So people automatically assume heroin is the opioid. But that's a very, very bad misconception, because opioids include other classes of drugs, and that is the prescription pain medicine that the doctors prescribe it with good faith, after a surgery or, after a car accident. Those are your oxycodone, your Vicodin, your Percocet. Those kind of medicines are still in the same class as a heroin. They act on your brain receptors the same way, and if you take too many, can give you that euphoric, that'll give you the same, what they call a high, that feeling. and you can start to get dependent upon them. And that's how people oftentimes get addicted to opioids by accident, and that's really unfortunate. And but what I will tell you is that heroin is killing a lot of people, but opioids is not just a heroin addict with a needle in their arm. There are a lot of people living day to day in the business world in professional positions that are addicted to prescription pain medicine as well. Yeah. So it's important to sort of dispel that myth that it's just heroin.
Okay. So now we know what it is, what we're talking about, what drugs are involved. Alcohol is still number one. So you've got sort of a coalition, if you will, of people involved talking about this in the community and educating people and getting people involved and trying to find ways to help families, those addicted, give back to the community and get the communities back where we want them to thrive. So who all is involved in this, and talk to me about what is actually taking place.
Sure. So our first two meetings, so our first meeting was last November, and we meet monthly. Our first and second meetings, so November and December, we met as a 5-county council. And the state in our grant gave us what they called key stakeholders, and sometimes people thought that meant they needed to give money, but what the state meant by that is these are people that have a presence in the community, and we really want them to be on the council if at all possible. And so that included what they called PLEs, persons with lived experience. That's going to be people in recovery who've been there, done that, been on the front lines of addiction and have transferred over to the recovery side. They're the most important people that sit on our council. And then we also needed representation from law enforcement, doctors, judicial system, legal system, business owners, hospitals, pharmacies, the list, it was just huge. It was like literally, and I was a little bit nervous when I started because to me, the community had to be ready because there really wasn't a buy-in to give them. You know, either they were going to care or that sounds bad. Either they wanted to get involved or they didn't want to get involved. Right. It wasn't like I was offering them money or you know, recognition or fame. But I'll tell you what, I just got on the phone and I started calling places through all the 5 counties, and I only had 2 people say no. Yeah. It was crazy just how ready our community is to just get healthier and to just be better all around. So it started as a 5-county council. At our first meeting, we had 105 people attend. That's huge. We filled up the Lifespan Center. And then the next meeting, we had 100, and we did it at the hospital. And then after that, we sort of decided collectively that each county looked really different. You know, Coles County, since we have treatment facilities and long-term rehabilitation programs here, we're a little more progressive when it comes to accepting recovery. Business owners, they hire people in recovery. And then some of the other counties that we're in are a little bit, you know, they're a little bit stuck in the past, need a little more help. So it looked better. No, the councils decided on their own that they would rather split up for now and then come together every 6 months or so collectively and meet and share what the other ones are doing. So we meet monthly at in each county: Coles, Cumberland, Douglas, Shelby, and Effingham, and they're all working on very different things because we're all in very different places, but they're all moving with great speed.
Well, that's good to know. Even though we're closely related here, you know, the counties touch one another. Each county has its own personalities and the different things that are going on in each of these counties, so it doesn't always look the same. So I can understand why you know, each of the counties are doing their own thing because they know what needs to be done in their own particular county. So talking about how long this has been going on and some of the successes and maybe some of the hindrances that you've had along the way, talk to me about some of the gains as well as some of maybe the stumbling blocks or learning curves.
Yeah, sure. So we received the grant in August. We started in September. We've had monthly meetings ever since November. Oh my goodness, I feel like I could go on for days about successes. So I'm just going to pick a couple things that stand out. You know, one of the counties that I thought, would be sort of hard to make changes in, if that's the right way to say it, has actually formed such a beautiful council that we've made the most changes. And that's Effingham. So in Effingham County, at HSHS St. Anthony's, Dr. Jennings is their chief medical officer, and three of the people from the board sit on our council, and we actually were able to write into their policy and procedure with his help a way they started allowing people who were addicted to substances and alcohol come to their hospital and detox, which means medically get off the substance so they could stay clean, the goal. And we put into their policy and procedure a way to allow people who are in recovery to actually go to the hospital and have that primary intervention with that person, so they can put a face with a name, get a phone number, have someone to contact when they get out, so that there's not just that, the cycle doesn't just continue. That to us was huge. That's something that's really innovative around here. I don't think any of our other area hospitals have taken that step yet, and it's awesome, and we're really excited to get that going. We've done a lot. In Cumberland County, we're getting ready to do a quick community needs assessment with their students, grades 6 through 12, just to see, do you have a problem with substance use? Does your legal guardian have a problem? And would you like help for that? And if they want help, we're going to offer services. We're working with their superintendent to offer a flex period in their school where we can actually bring support groups to them, so they don't have to leave school and feel stigmatized getting treatment outside of school. It's really important for us to remember that when you're suffering from drug or alcohol addiction, you feel shame, and you feel scared, and you feel like people are going to judge you, and oftentimes they do. So we're really working to reduce the stigma and to promote recovery and to promote what long-term recovery looks like. And so we've partnered with Eastern, and we had a wonderful intern from the Health and Human Services, Eric Davidson, sent over. Her name was Emily, and ROSC was her job for the semester, and she successfully started a recovery club at EIU. They had a recovery week that we helped them, set up. We're in the process of helping some of those students that are in that recovery club. We have people from the AA and the Celebrate Recovery, which is a faith-based recovery group, going to set up meetings on campus come fall for the students, so they have support. We live in Charleston, and sometimes Charleston, I feel like sometimes we forget that there's Eastern students here and that they need the help and support too. That's just a little bit. I could go on for a day.
List that goes on and on.
Stop. The hindrances, anytime you have a passion for something, there's always going to be some opposition to that, I think, sometimes. It can be hard to have certain populations of people who've been ingrained to feel a certain way about drug and alcohol addiction for their whole career to sort of have a mindset change. And without going into detail about those populations, I don't want to make people feel uncomfortable, is, trying to remind people to remain open-minded, and that sometimes what you've been taught is just learned discrimination. It's not necessarily the truth. So really trying to educate the public on the disease of addiction, how we can help. Narcan training, which Narcan is the antagonist to opioid. So if someone goes into an opioid overdose, you can give them Narcan and they can come back from that. And telling the public, every health department has Narcan, and you don't have to have a prescription. You can go get that for free. So if your son or daughter is a heroin or addict or addicted to prescription pain pills and you're worried about an overdose, carry it in your purse. Everyone can have it.
It's a life-saving measure.
A life-saving measure that everyone can do. So, just trying to help people see the bigger picture sometimes can be difficult, but really I would say 75 to 85% is always, it's just real positive.
Yeah.
You always have a few that, okay, I'll come back, I'll revisit you in a few months, maybe after we've done some work, and then you can see if you're ready to jump on board now.
Yeah, well, and I think that's with anything, there's an education that has to take place and a learning curve, and for the people who may have a misunderstanding or something like that, that's why we're doing the show today, is to help get that information out and to let people know, what's coming their way, what's taking place in their community. So I don't think that it's anything out of the ordinary, when something new comes into the area. So I think what is happening out there is really neat. I'm glad to see that there's community involvement. There's been a lot of successes. So what are some of the things that people can look forward to happening maybe in the next steps of this? Is this a year-long grant? How long does it go on? Explain a little bit about that.
Sure. So it was a year-long grant just to start. I think Illinois is just getting their feet wet in this kind of recovery movement. Other states in the Midwest and states out in the East and West Coast have been doing these ROSCs and then RCOs, which are recovery community organizations, which is the next step up from a ROSC, for years. And Illinois is just finally now working on a statewide ROSC council so they could have that at the state level, really trying to mold ourselves after Minnesota. When we partnered with some Minnesota people to help us get there. So it was a year-long grant, but they quickly realized that it wasn't going to be done in a year. We finally, you gather these community important people, but you can't expect them to continue on without any guidance, because it's still kind of new to all of us, even including myself.
Yeah.
And so they renewed our grant, and if the statewide ROSC gets into place, I have full faith they'll keep this grant renewed until this council is actually, self-sufficient. And that might be 5 years, that might be 10 years, but the goal is to keep these around forever, to just continue to add more support for people in recovery along their journey, from day one to the day they're gone, and how we can all band together. But next steps, before next steps, the beautiful thing about ROSC is it's all inclusive. We want anyone who wants to be involved to be involved. You don't have to be a doctor or a police officer or a teacher. If you're sitting at home and watching this and you feel passionate about this, or you just want more information about this, feel free. I can give my email at the end of this. You can email me or call for more information. We'd love to have you at any of our meetings. So it's all inclusive. We encourage churches to get involved. Even we're not saying there's one path to recovery. We're saying we just want people to recover. And to me, that's beautiful, because my recovery doesn't have to look like your recovery or her recovery or his recovery. It just has to look like a recovery. And so the next steps are to really continue to educate the public on what addiction is and the disease of it, really encourage the public that they can take ownership in this and then get involved and feel really rewarded from it, and then continue to just make changes. And we're going to definitely focus on the children of drug and alcohol addicted parents. Oftentimes they're forgotten about, unfortunately. Maybe there's not enough for them to be taken from a home, there's not enough for them, but they're still suffering. They're the ones missing school, they're the ones who are slipping through the cracks, and we definitely want, all of the councils have really decided to focus on that population for the next year too.
That's good to know. I think that when you say, important people are involved in it, really everybody that is involved in this is important. Those who are struggling with it, the kids, it takes a village, doesn't it?
Oh yes, it takes a village and then some, I think sometimes. People, think when someone, I was talking to a police officer the other day. This is just an example. And he's actually a police officer. He was a sergeant out in Colorado. And he told me, he had been taught from the time he went to boot camp, and then he decided to be in law enforcement. So basically his whole adult life, that a drug or alcohol bust, as he called it, is a victimless crime. And he had a mindset change when he heard a presentation one day from a person who was in recovery and now in law enforcement and social work. And he said, it's not a victimless crime. The person who is doing the drugs is a victim. They're an addict and alcoholic, and they need help. But more so, even the children living in the homes are victims. It's like oftentimes that when I was talking about learned discrimination, it's not that people really feel like that. It's just what they've been taught. So it's really important, to sort of change that mindset and just show people a bigger picture.
Absolutely. And I'm so glad that you were here today to talk about this. I think on that note, it's a good way to close this episode of talking about recovery and community involvement. But I want you to tell people how to get more information on this. If you have an email, if you have a phone number, you can go ahead and give that information now.
So my actual email is seed, that's C as in cat, E as in elephant, A as in apple, D as in dog, seed Jenna, Jenna, at mycci.net, and my telephone number is 217-258-6018. And then Seed Council's main number, which is the substance use treatment facility in our area. We have inpatient and outpatient and prevention for adolescent and adults. The number there is 217-348-8108.
All right. Well, thank you so much for what you're doing. Thank you for getting this involvement in our area. It's highly needed, as you said, and I'm glad that we were able to get this information out today.
Thanks for having me.
So thank you for joining us for this episode of Being Well, and we'll see you next week.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.